Good morning. Hello, hello, hello. I have Lily here with me this morning. She has not been behaving well. Oh my gosh. I don't know if you guys have dogs who have, for some reason, she gets really aggressive over food and barks like a maniac. Ugh. Anyway, so that's why Lily's with me this morning because she was misbehaving in the dog bowl. We have another dog, Luna, and she was going after Luna because Lily can be a stinker. So, anyways, but the benefit is Lily gets to be with me today. So, alrighty. So, I am so excited to be here this morning. I am talking about one of my favorite topics, which is parents in the play therapy process. I want to talk about the pros and cons of having parents in the play therapy process. So when you may hear digging because I closed the door and she likes to be in charge. Lily, that is. So when to have parents in the playroom, the benefits of parents in the playroom, and maybe when it's probably not a good idea. So that's what I want to talk about today. If you're joining me live, go ahead and post your name in the comments, post where you're from, what population you work with. I'd love to hear from you. So let's get started for today. So I'm Kathy Spooner. I'm a licensed clinical social worker and a registered play therapist supervisor here in the United States. And I have almost 30 years experience in the mental health field working with children, adolescents, and families. And I love using play therapy and expressive arts. I love using play therapy for family therapy. And I love getting the whole family into the playroom. At the very least, parents and their children or caregivers, if the children are not living with their parents, because I think it gives you a really good idea of the child's ability to use parent for co-regulation, to use parent for support. How do those relationship dynamics, the attachment patterns, how do those work within the family system? If you get the siblings in there, then you get a little glimpse of what the family relationship patterns are overall. So I'm always a big fan of having family members in the playroom. So we have Erin from Kansas. Oh, that's exciting. MSW intern working with traumatized teens in juvenile justice and other. That is some hard work, and you are getting some excellent experience. So that's awesome. And those are really challenging populations. I think my experience is if you have court involved families, then you're probably looking at higher acuity family systems. So those are some of the family systems I was planning on talking about today, the higher acuity. And you usually in that population, you let me know if this is true for you, the work you're doing there, Erin. You usually have a high level of poverty, addiction, trauma, and attachment disorders generationally. Not always, but it's pretty typical within that population. So they're a little more challenging to work with. And I definitely like to use a neurobiology and attachment lens when I'm working with families and when I'm working with parents. I find if I use an attachment lens, then it gives me a nicer framework to try and establish therapeutic rapport with parents. So I'm going to talk a little bit about that today as well. So if you're joining me live, go ahead and post your name in the comments. If you're watching on the replay, post your name, where you're from, comment in the comments. So let's get started. So to me, it makes sense adding parents into the playroom because they are the therapeutic agents of change. And what I mean by that is children live within the context of their parents. Parents, I'll use parents, caregivers, the adults in their lives who are in that parenting role, because children live within that context, and the parents are, I like to use the term leadership, like they're the leaders in the family system. And what kind of a leader are they? They are the ones, an analogy I like to use all the time, probably the people that work with me get a little tired of me saying it, but the parents are the drivers of the bus. The kids are on the bus, parents are driving it. They'll interact with the kids, but the parents are the drivers of the bus. To think that children can drive the change process is not realistic because the parents are the ones who are leading the way. They're the decision makers, they're the legal guardians who are responsible. Now, um, parents' ability to engage with their children, consider their children's needs, get feedback from kids, have that collaboration piece, that's definitely important. And in the end, parents are, from an attachment standpoint, I love the way that circle of security model says it. They say parents are bigger, wiser, stronger, and kind. So that's what we're helping parents to be with their kids: bigger, stronger, wiser, and kind, so that children can use their parents. And I like to include siblings, but we're not going to talk about that today. But for the record, I think sibling relationships are something in the play therapy arena we don't really talk as much about as I think we should. So what are some of the benefits of having parents involved in the play therapy process? And like I said, parents are the therapeutic agents of change. So optimum healing occurs within those attachment relationships. Parents are the ones who do the co-regulation. They're the ones that help their children navigate through difficult and challenging times. We can't prevent difficulties from happening to our children, and we also want to be on the alert, so to speak, to make sure that we head off things that might be a little too overwhelming, or we get involved to intervene and advocate. And some things as parents, we need to allow children the opportunity to experience and work through those things so that builds their resiliency. So having parents as part of the treatment process allows the ability to strengthen those relationships, to help parents read the cues, so to speak, of their child more effectively, help the child use their parent for support as they navigate through life. Um, and so, in that way, the healing part is children learn how to navigate relationships in a healthy way. They realize relationships are safe and supportive. You know, you can't live in a family without getting on each other's nerves. So we're going to get irritated. How do we work through problems? How do we communicate? How do we think about other people's needs rather than just my own? Because within a family system, it's not just about one person. It's about balancing the needs of everyone in the family. So if we have parents in the process, we can see how that works. We can partner with parents to help them be bigger, stronger, wiser, and kind. As the circle of my mouth's not working, as the circle of security model would say. So we can help parents. We can encourage them. We can support them. We can give them ideas. We collaborate with them in the same way that we want them in a parenting way to be able to collaborate with their children. So We're modeling those relationship dynamics with parents. We're helping them to apply those attachment-based parenting skills with their children. If they're actively involved in the treatment process, then we'll be able to do that. And I am not talking about the 5 minute, I call them drive-through parent sessions in the waiting room when you bring the child out to the walk them out to the parents. I'm talking about a dedicated time that you have on a regular basis at the very least in order to engage with parents, and then decide from there when we may want to get parents into the therapy office with the child. This is even true with adolescents. I like to meet with parents first and get to know parents. It gives me time to get to know the child or the adolescent, to establish those therapeutic relationships with them. And then from there, we kind of work collaboratively together to see how we want to put everybody, or who goes in the same room. So Facebook user says, oh, and I always forget to say, if you're on Facebook, you need to give StreamYard permission. And the only thing that means is it lets me see your name, which if you don't want me to see your name, that's fine too. But just so you know, that's why you're showing up as Facebook user. Facebook user says, yep, in general, generational cycles of poverty, addiction, trauma, cruelty. But the sexual trauma work, there's also a large group of predatory victims resulting from social media, which spans. Yeah, that's a really good point. I think as parents are trying to figure that out. We didn't grow up with this with our kids. As kids, like in my age, we didn't have the internet even when I was an adolescent. But when my kids were teenagers, they were just getting cell phones, and Facebook was kind of a new thing. But now it's so prevalent. Parents are having to try and figure that out. And kids are trying to figure that out. I think as professionals, we're trying to figure out how to support adolescents and even kids on social media and managing all of that. I think school systems are trying to figure it out. It just adds a little more complexity, and it is a reality. So we do need to kind of sort that through, I think. So the other thing is, parents, if they're involved in the treatment process, they can become advocates for their child at school or in the community, wherever if their child is having trouble at school. Parents can be advocates for children at school. The other thing is, if we are involving parents in the treatment process, especially with children, even with adolescents, if we're teaching skills to the children and we involve parents in that skill building activity, and for those, a lot of times what I'll do if I'm working with the child, maybe we spend about 30 minutes learning the skill and practicing it. And then we'll invite the parent in for like the last 15 or 20 minutes and talk to the parent about the skill. I have parent and child practice the skill together. They come up with an idea how that can be implemented at home. We have a discussion about how parent and child what the child needs from the parent in order to practice. So we get that feedback. We get feedback from parent about how they think it might work more effectively. So we do that collaboration with everybody in the room. And then parents are the ones who are going to be critical for applying that skill in the child's everyday life. 45 minutes once a week in my office is not going to be the key to success without somebody in the child's life helping them apply that skill in their everyday life. So if we have parents involved in the process, then parents can help their child do that. And I'll often assign that as like homework for the parent and the child to do together, or the child to do. So these are really important to me, important reasons why we as mental health professionals working with children and adolescents, especially in the play therapy process, if we're why we want to involve parents, not just those drive-through meetings at the end. I mean, really involve them in an intentional and collaborative way, because I think it's really, really important, because parents are the drivers of the change process. They are the ones supporting their child. So the thing is, though, sometimes parents are not therapeutic agents of change. And these, I think we typically find these in the higher acuity family systems. And what do I mean when I say higher acuity family systems? I mean parents who are lower functioning overall. So typically we find higher acuity families. So I'm going to make a general statement. And here's the thing. It is not applicable to all parents. I'm going to make the general statement and then I'll kind of tease it out a little bit. So generally speaking, if we have higher acuity families, then we tend to have families that have a generational history of trauma, attachment problems, poverty, and addiction. So that healthy family relationship and attachment patterns are not passed down. So all of that kind of from a neuroscience standpoint, attachment standpoint, attachment theory would say we create these internal working models of what relationships look like. Daniel Siegel would call them me maps, you maps, and we maps, the way in which the mind maps out how relationship works and how we perceive others and ourselves within relationships. So those internal working models are going to get passed down through the generation through a variety of different ways, because we also know from epigenetics that trauma can get passed down through the biological genetic process. So that's generally speaking. Here's the thing. Not just because it's a lower functioning family does not mean parents will not be able to be involved in the treatment process. I have worked with so many parents who come from generational histories of trauma, addiction, poverty, attachment problems, and they have this internal drive for things to be better with their kids. And those are the parents we want to support. It is really important to develop that therapeutic rapport with those parents, because they do need support. They do need encouragement. They need skills, and they're open to it. So those parents would definitely be beneficial to include in the treatment process. The parents that we want to look for, and this is part of that clinical decision making that we do early on, is kind of do that assessment of parents' capacity to be the therapeutic agent of change for their child. So the lower, my dogs are all barking today. They are driving me crazy. This is one of those days where you got to just go with the flow, use your DBT skills. That's what I tell myself. Anyways, back on track. So some of the things that I look for that give me an indication that a parent may not be able to function in that therapeutic agent of change role. So these would be parents who have an active addiction. If a parent has an active addiction, they are not going to be able to be that therapeutic agent of change for their child. And in fact, it may do more harm having them in the treatment process. If a parent has an active mental illness with psychosis, they're not on their medication, they're not able to be a therapeutic agent of change for their child. If we have a parent who's got a pretty severe attachment wounding in adulthood, we would call those personality disorders. That's how I look at personality disorders. I look at them as attachment disorders in adulthood. So if you've got a parent with a pretty significant personality disorder, then their capacity for attachment is really limited for their child. Their capacity to help create that attachment relationship for their child and with their child is pretty limited. Again, you really want to assess, because even somebody who's got a pretty significant attachment challenge, if they're open and willing to work through the process, then there's some resiliency there, and we want to tap into that. So this is where your clinical decision making comes in, to try and figure out, can this parent be a therapeutic agent of change for their child? The other thing is, if you have a parent who is not the custodial parent, and that parent is kind of in and out of the child's life, kind of unreliable, makes promises and doesn't follow through, then that's probably not a parent who is going to be a therapeutic agent of change and part of the healing process, because that's what we're looking for. We need the parent to help facilitate that healing for their child. So if you have a parent that's not able to do that, I would really think long and hard before I integrate that parent into the treatment process. And then the other thing is, if a child has experienced trauma, abuse by a parent, if the parent is not at a place of taking accountability, taking ownership, and being committed to engaging with their child in a healing way, then I would not include that parent in the process. So here's the thing: when you have to make sure, sometimes it's not possible, and you just have to do your best clinical decision making. These are things that we talk about in my supervision group. So I have an online supervision group, and we meet twice a month. These are a lot of the things that we talk through in the group, that clinical decision making. What kind of parents are going to be, like, not what kind of parents, but what are the characteristics, the capacity of parents that we want to look for, that are going to be optimal or even amenable to being that therapeutic agent of change for their child. And then we kind of talk through, especially the high conflict divorce families that are court involved. And sometimes there's a lot of allegations of abuse, and CPS gets involved, and they can't identify anything. And one parent is saying abuse is going on, and the other parent is saying that other parent is trying to set me up and it's not happening. I mean, these are very complex family systems. So when you're talking about allegations of abuse, you also have to navigate that process of, did abuse take place, which is not necessarily our role to investigate and determine whether or not. What we want to look for is this a parent who's going to be a healthy part of the change process when there's been allegations of abuse? And there are lots of things that we can look at in order to figure that out. And and we'll talk about those kinds of things in my supervision group as well, because these are pretty complex things to have to figure out. And sometimes it's hard. Oh my gosh, my dog Lily, you can probably hear her behind me. It is a dog day today. Lily, stop. Anyways, so those are, to me, those are some of the things that we want to think about when we are deciding if and how to integrate parents into the play therapy process. Um, so if you have some of these higher acuity families, to me, one of the strategies I use and also recommend, and I do consulting. We've talked about this in consulting. I talk about this in my supervision group and people that I supervise. Using an attachment lens to create that therapeutic rapport with parents, caregivers, is really important, because if you want to bring them into the change process, meaning we're inviting them in. Oh my gosh, my dog. Lily, stop. Oh, sheesh. Um, it's like having kids, unruly kids in your house. Um, Parents, when they believe that you care about them and they can trust you, and you're capable, because you want to make sure you're skilled as well, um, then they will more likely trust you to try out some things that don't make any sense to them. Because remember, if you've got high acuity families, we're often talking about generational patterns. So we may be asking them to do things that are totally foreign and go against what they were taught and what they saw worked. Not really, as it only instilled fear. Fear is not relationship. So we may be asking them to do things they're not comfortable doing. If we establish that trust with them, there's a higher likelihood they'd be willing to give it a try. And with the higher acuity families, it sometimes takes time to earn that trust with parents and develop that safety and security with them in the change process. So to me, that's why you want to make sure to assess these things. Is this a parent that can be involved in the treatment process? Or is this a parent that's going to quite possibly do more harm to their child? And it may not be a good therapeutic agent of change in the process. If that's the case, you want to look for adults in their life, or other supportive kind of people, not just peers, but sometimes peers are okay in adolescence. So you want to look for some of those adults who can be, maybe other family members, and maybe church members or community members. You may want to think about those things, who can be that supportive therapeutic agent of change for your client. So that wraps it up for today. Let me go ahead and do a recap. So optimal healing, in my opinion, occurs within the context of those attachment relationships, and I include siblings, for children and adolescents. So if we can find a way to include them in the treatment process, I think that optimizes long-term treatment success outcomes for your client, because they're going to be with your client way longer than you are. I always say I'm just a dot on the lifeline of my clients. I always try to be a good dot on the lifeline of my client, and one that is helpful and beneficial. In the end, though, if we can improve and strengthen those family attachment relationships, then those are lifetime relationships. So that's, to me, one of the main reasons for strengthening those relationships and including parents, and even siblings in the treatment process. The other thing is, parents are the driving force for facilitating change. They're the therapeutic agents of change. So we most definitely need to try to get them on board and be effective in that role. And then thirdly, the therapist needs to assess the parent's ability to be that therapeutic agent of change for their child in the treatment process. And if they're not stable or not healthy enough to be that therapeutic agent of change, then we probably need to not include them. Sometimes we have to if they're court ordered or things like that. And if that's the case, then that's where a lot of the clinical decision making comes in, and figuring how to navigate through that. And if the parent can't be that therapeutic agent of change, who can be? Who can we integrate in to help fulfill that role for their child? So that is it for today. I'm so glad you guys joined today. It was nice interacting. Great points. Definitely. If you're interested, I do have an online supervision group for play therapy and expressive arts for therapists who are working with children, adolescents, and families. We meet twice a month for 90 minutes. It's online, so we have people from all over. If you're interested, contact me. You can send me a private message or comment in the message here, and I will get back to you. I like to schedule a video call first. That way I can tell you about the group, make sure it's a good fit for you, make sure it's the right time. I have definitely one space, maybe 2 spaces available left in the group. We meet on Saturdays. So if you're interested, contact me, message me. What do you call it? Well, put a comment in the post, tag me. That's what I meant to say. And I will see you next week. Oh, Aaron said, I'm interested. Yes. Aaron, message me. And I think you're in the group. I'll go in the group, message me, and we'll schedule a time, a video call. That'd be great. Awesome. All righty. See you next time.